mechanisms must operate in an integrated fashion if oxygen needs of the active tissue are to be met and extra carbon dioxide and heat are removed from the body during exercise. The circulatory changes maintains adequate circulation in the rest of the body while the increased extraction of oxygen from the blood in exercising muscle ensures adequate ventilation. This provides extra oxygen and eliminates extra carbon dioxide and some amount of heat. Changes in ventilation. During exercise, the amount of oxygen entering the blood in the lungs is increased because the amount of oxygen added to each unit of blood and the pulmonary blood flow per minute are increased. The PO2 of blood flowing into the pulmonary capillaries falls to 40 to 25 mmHg and thereby an increased alveolar capillary PO2 gradient is created and more oxygen enters the blood. Blood flow per minute is increased from 5.5 liters per minute to as much as 20 to 35 liters per minute, and thereby total amount of oxygen entering the blood and carbon dioxide extraction are increased markedly. The increase in oxygen uptake is proportional to the workload to a maximum. Above this maximum, oxygen consumption levels falls off and the blood lactate level continues to rise. The lactate comes from the muscles where aerobic synthesis of energy stores cannot keep pace with their utilization of an oxygen and oxygen debt occurs. Note that oxygen depth in any type of muscular exercise, oxygen requirement increases. Consumption of oxygen increase during 2 to 4 minutes of exercise and then reaches plateau. So in the beginning, during adaptation phase, an oxygen deficit is established. This deficit is caused by the lag of circulatory adjustment during the start of exercise. During this period, the muscle stored of ATP are used. This deficit is repaid in the form of oxygen depth. The oxygen depth may be defined as the amount of excess of oxygen that is consumed during the recovery after an exercise. The physical performance is inversely related to the oxygen deficit. In this diagram, you can see when you are exercising, there will be deficit of oxygen is created because there is an improper circulatory adjustment occurs, and then the steady supply of oxygen occurs during exercise. But when suddenly person stops exercising, but the cardiorespiratory adjustment will not come readily to the normal, still they will utilize the oxygen, and this is called as the oxygen debt. That is the oxygen deficit which is created in the initial stage of exercise will be recovered after the exercise. Oxygen deficit is decreased by warm-up and training. Oxygen depth is meant for reoxygenation of hemoglobin, regeneration of depleted stores of ATP and creatine phosphate, removal of accumulated lactic acid from muscle tissues, that is also called as lactic acid oxygen debt, and it is to resupply of dissolved oxygen in the tissue fluids and blood. Ventilation increases abruptly with the onset of exercise, followed after a brief pause by a further more gradual increase. With moderate exercise, the increase is mostly due to an increase in the depth of respiration, and when the exercise becomes more strenuous, this is accompanied by increase in the respiratory rate. Ventilation abruptly decreases when exercise ceases, followed after a brief pause by a more gradual decline in pre-exercise values. The abrupt increase in ventilation at the start of exercise is presumably due to the psychic stimuli and afferent impulses from proprioceptors in the muscles, tendons, and joints. The increase in ventilation is proportionate to the increase in oxygen consumption. Exercise increases the plasma potassium level, and this increase may stimulate the peripheral chemoreceptors responsible for stimulation of respiration. In addition, sensitivity of the neurons controlling response to carbon dioxide is increased, and there will be increased fluctuation in the arterial PCO2. Therefore, carbon dioxide is responsible for the increase in ventilation, although oxygen seems to play some role. When exercise becomes more vigorous, buffering of the increased amount of lactic acid that are produced liberates more carbon dioxide, and this further increases ventilation. With respect to respiratory system, there are changes in pulmonary ventilation, diffusion capacity of oxygen in lungs, and oxygen consumption. So this is given in a tabular form where the pulmonary ventilation at the rest is around 6 liters per minute, whereas it increases to 100 liters per minute, maybe 10 to 15 times. Then the cause of the increase in the pulmonary ventilation is a parallel increase in oxygen consumption and increase in the carbon dioxide output. And pulmonary ventilation is increased due to the stimulation of the respiratory centers from the motor cortex, and it also occurs because of the stimulation of proprioceptors of moving muscle, tendon, and joints. It also occurs because of the stimulation of the carotid bodies. Increase in the body temperature stimulates the respiratory center. Then increase in the lactic acid and plasma potassium level in the blood. Note that during heavy exercise, PV increase, pulmonary ventilation increase is not proportional to the increase in oxygen consumption and increase in carbon dioxide output. This is due to the anaerobiosis of working muscles, which contributes to extra drive to respiratory centers. Diffusion capacity increases to above at least 3 times, and this occurs because of the increase in the blood perfusion around air sacs in the lungs and opening of more capillaries, both increase in surface area of contact between alveoli and capillary. There is increased oxygen consumption about 15 to 20 times the resting values. This occurs due to the 3 times increase in arteriovenous oxygen difference, and 5 times increase in the oxygen delivery to the tissue, and increased oxygen delivery to the tissue is due to the increase in cardiac output, alveolar ventilation, capillary density, and